fundamental expression of Minnesota values. I really do appreciate that sentiment. I think there are 2 points that Medicaid provides that safety that I want to make. Medicaid provides that safety net for those folks who often need it the most. And then secondly, that there's a bridge between public safety and healthcare that I think Medicare supports in a foundational way. Healthcare alone cannot absorb the cuts. You pointed out, Susie, that in your slides there are $34 million in the next 10 years that you folks are going to figure out how to balance a budget. What do we do? That's not going to be fixed only by the Allina Healths and the Fairviews and the Mayos of Minnesota. That is going to impact small businesses like your insurance company, county governments in a big way. These are not just costs that can be shifted and figured out in a very easy way. It's a difficult problem. But the solution is not to gut the Medicaid system as we know it today. We got to fix it. There's problems. Everybody agrees. Whether you believe in a red state or a blue state or a purple state, Affordable Care Act has its issues. The current Republican proposals have its issues. We need to fix this together. So that bridge that is provided between public safety and healthcare is illustrated every day in the folks that are Medicaid recipients who are struggling and will struggle even more without some sort of solution. And I don't envy you folks to having to come up with that solution, but I applaud your willingness to do it collaboratively. And I suggest that without that commitment, there's going to be a lot of Minnesotans that are going to have a significantly different quality of life than they otherwise would have without your support and your hard work. So thank you very much for all you do, and I appreciate the chance to talk to you folks today. Thank you.
Thank you. Great. I'd like to welcome Rose Moriarty. She's an LPN and direct support professional for Living Well Disability Services. She has a 41-year-old son with disabilities, and Rose was awarded the DSP of the Year Award. This is a national honor for individuals who support people with disabilities and are judged by their success in helping people build social networks and engage in substantive community participation, and for the advocacy for people they serve. So thank you, Rose.
Well, where do I begin? When I was driving here, all I could think of was the road construction and the blocks that are put up before me to try to get here. And what should have taken me maybe 40 minutes took me about an hour and 20 minutes. But those road constructions meant a lot to me. I was born many years ago up in a little town, International Falls, way up north. I'm a northerner. I have 14 siblings. With my 14 siblings, I believe, because I was the second to the oldest, all children are born, you change their diapers, you feed them, they graduate to a spoon, they crawl, they walk, they go to school. You have the teething problems, you have the broken bones, but everything just goes in a regular scale. There were 14 of us. In 1975, a little black-haired, black-eyed baby was born into my life. He was my first child after 7 miscarriages who survived. I was told that little boy would never make it past infancy and to place him in Cambridge State Hospital because you can't grow attached to him, and this is where you put children like him. Well, my theory, damn it, I've had him this long, he isn't dead yet. And if he's going to die soon, why can't I hold him and cuddle him until it happens? Well, that little boy today is 41 and a couple weeks to be 42 years old. That little boy who was supposed to be a vegetable is walking, using sign language, making people laugh, and a lot of times I'm asked, or rather I am told, it must have been a rough road, and it's hard not to have a normal child. Well, let's see. What did I say? He's in his 40s. He loves motorcycles. He loves leather. He loves beer. He loves music. And he loves to work. Now, I think that's pretty normal. Well, maybe not the loving to work. That may not, but the rest of it is pretty normal. Yes, he does not speak. He uses sign language. He uses gestures. He has blessed me in so many ways. But one of the things that scared me the most was the fight that I had as he was growing up to get him services that he needed. I was a single parent for the majority. His father died the day he was born. His stepfather died when he was 12 years old. For many years, I worked this long road to get services for my child. But I have to tell you, while I was fighting, and I fought, I went to Washington, D.C. to fight, I went to town hall meetings to fight, I went to Stearns County asking to speak to anybody and everybody and screaming and yelling. I fought because my son needed services and I had to provide these services or I would fail as a mother. And I wasn't going to fail as a mother. Now, you're wondering what services we had back in 1975? Absolutely none. What services did we have in 1977? Not a heck of a lot. We didn't have respite services. We didn't have in-home services. We didn't have a lot, and we had to fight. There were places that had respite services in the early 70s, but Stearns County, it had not reached there yet. So we were still fighting. Why was I fighting? I was fighting because I was a single mom working a full-time job. I was fighting because my son needed somebody to take care of him. And there's lots of people out there taking care of little babies, but when they start to be 4, 5, 6, 17, there's not a lot of people out there that's going to be able to babysit your child. Why else did I need respite services? I needed respite services because my son sleeps 2 hours a night. Not anymore, and if he has a 10-minute nap, he doesn't sleep at all. So I had to get up at 6 o'clock and go to work after I made sure that I had daycare for him. And I had to sleep only 2 hours a night. And then when I did get respite services, one of the rules for respite services at that time was, quote and unquote, you cannot sleep. So I couldn't do my 10 hours a week of respite services taking a nap. So what was I going to do? But the fight went on. My son was one of the first children, thanks to PACER and other parents that fought with me, to be able to enter into the school system when he was 4 years old. He was one of the first kids at 18 years of age that was given the chance to graduate after attending all those years in school and go on to a transitional program, which also was a blessing. And we had all these things. But then as years progressed, I started getting worried. But I made a fatal mistake. My fatal mistake was that I didn't continue to fight for the services of the children of today. Because we cannot lose any more services. We cannot lose speech therapy. We cannot lose occupational therapy. We cannot lose physical therapy for our children. When we lose these things, our children lose. Our children lose the ability to survive. Our children lose the ability to become productive members of society. Because even language, it's even sign language, and anybody can learn sign language. It's really easy. Mom, how do you get mom? Mom's because women tie a scarf under their neck. Sign language is really easy to learn. And now at 62 years of age, I am going to be back fighting for the rights of children and for my son to continue. Because one of my scariest things right now is that something would happen to me and I would not know what would happen to my son Nooners. And the scariest part about that then leads to the fact that I feel terrible, but my heart feels this. I feel terrible to think that I would want him to pass before me so I could take care of him. Then I want to tell you about another person in my life. Miss Melanie kept. Miss Melanie was a concert violist. She was a speed walker. She was a smiling, gregarious, wonderful woman who was struck with MS. 15 years ago, I began taking care of her. I moved in with her. I took care of her 24/7. She became one of my best friends. How did Medicare help us? I'll tell you how it helped us. It helped us so she could get an implant of baclofen so that I would be able to continue to keep her in her home so she could be taken care of and have her wish of living in her home for as long as possible. It helped us get a ceiling lift. Dakota County helped us with that. Praise the Lord to Dakota County. We got a ceiling lift so we could get her into the bathtub from her bed. Miss Melanie, in October, had to make a choice of going into hospice or continue to fight through medications and other things, and she chose to go into hospice. We weren't able to take our last trip, but we had lots of trips. We even went to DC to fight with legislators in DC. We went to Seattle, we went to New York, we traveled because that was one of her joys. And her family helped her with that. But again, the equipment that we could use so she could fulfill some of those dreams was awesome, and they were provided through Medicaid services. And now we have loaned them out to other people who need them, who do not get Medicaid services for whatever reason. And it's sad to know that, but they don't. So we've loaned out a stander walker. We have loaned out a Hoyer lift. We even loaned out a wheelchair. Now Miss Melanie, one of the joys of my life along with my son Nooners, passed away March 23rd. But without the services from Medicaid, she would not have came home from the hospital. The doctors had said she'd never make it home. And the ride from the ambulance, she would not survive. Well, she made it home. She came up through the ramp, she came into the house, and she just smiled and said, "I'm home." And I said, "You certainly are." So that was October 14th. The middle of March, I started to see a huge decline. And then on March 18th, she called her daughter in Israel and said, "You better come home." And I lost her March 23rd. But she also, services were so important to her to be able to lead the life that she possibly could. She was in her wheelchair. My son is not creed-shaped. They are people. They are loving, giving people in our lives and in many other people's lives. Melanie was able to be a bridesmaid when she was in a wheelchair, and Nunes was able to be a best man at his cousin's wedding. Those are things that normal people do, and they need to be thought of as normal people. And they're workers. They work. They brought home paychecks. Melanie worked most of her life, even in the wheelchair. She was a greeter at Walmart forever. And then all I can say is, she's a taxpayer too. And we have to remember that. Thank you.
Thank you. Thank you so much to all of our storytellers. Just as a few notes here, we're going to hear from elected officials next. But if anybody has a question, if we are able to have a question and answer session, please just hold up a card and Marnie will take it from you. Jessica here, just for our elected officials, Jessica, show the sign. This is for you. So you have about 2 minutes, and Jessica will give you a warning so that we can keep things moving because we've got a few extra folks.
So we'll tell everybody that we've got 30 seconds, so we keep it to 2 minutes.
Right.
So we really got to keep it tight.
All right. Thank you, Senator Schiff.
We can start. Go ahead, Senator Carlson. We'll move through and all. And then, what I'd like to do is, I know that I'd like to hear from the county commissioners first. because there are flow-through for a lot of these programs, and if you will have anything to say in particular about that, we'd be grateful.
Keep it brief, please. I said
You have
briefly.
30 seconds.
Oh, okay. Thank you. I'm Washington County Commissioner Carla Vega. A lot of what has been mentioned today, I don't want to repeat, but counties are the safety net. They help administer the programs. Kate and Jamie, you mentioned the PCA, a social worker. It was a county official that screened you guys for those services. And so what is, I guess, very concerning and troubling for counties is that if this federal program goes through and these cuts or reductions go through, the state is gonna have limited funds, be limited. That's a direct drop to counties, and we only have one way to raise money, and that's levy increases, that's property taxes. And it adversely and it alters the relationship between the federal, the state, and the local. And I think everybody on that panel, I called this session about local control and relationships. So a couple concerns that have not been mentioned that I think are worth mentioning is we are in the middle of an opioid crisis epidemic. And we also, suicides are increasing. These are services that counties provide and administer programs with the help of Medicaid that will end up, our jails, our county jails will end up having, now I got the stop sign. Officer shall drive to stop for them. But the other thing is long-term services that we also provide. So this is very, very concerning about how this is gonna just force counties to either pick up the tab for the services and also the services that these folks were receiving before before the Affordable Care Act, for example, maybe they went into a hospital. I mean, we don't have a public funded hospital, and I know Dakota County does not have a county hospital. Yeah, county hospital, I'm sorry. And so, but other parts of the state do, and that's gonna be a big tab we have to take, so that's a concern.
Thank you, Mike Slavic, Dakota County Commissioner. It's certainly my pleasure to be here today. Share a little bit on the county side. I think we talked earlier about how Minnesota's there's a Minnesota way to do things, and I think that even at the county level, most states across the country, the counties are not the ones who are implementing those services. Counties are an arm of the state of Minnesota, and the state of Minnesota, the legislators, the Senate, and the House, they trust the counties to go in and be that local level to go and provide those services. So that is, Commissioner Brigham had said, is that where those services are done really at the direction of the legislature and the governor, and state statute goes and allows us to go and do that. It's important to note that even with that, as we've seen before, there's a large chunk of money that comes from the federal government, there's state resources and state dollars that are put into that, but then there's also local, there's county dollars. So throughout all these processes here, through administration, through management, this still is mostly funded at the state and the federal level, but there's also funding that is coming out of your property taxes to provide those services and the staff that goes with that. So I think this has an impact. I think it's a couple points to bring up. One, that this is a lot of, there's an economy that goes to Medicaid. There's employers, both the private sector, the nonprofit sector, and the government sector that go with that. And I think that the final point that I would add is that you look at our senior population. We are an aging society. We're getting this senior tsunami is coming in here, and the impacts of what that's going to have on our senior citizens. And once their assets are depleted, Medicaid is the answer to that. So I think that there's some serious concerns coming down the pipeline.
Councilmember Mills or Councilmember Dennis, Cottage Grove, Hastings, and South St. Paul receive EMS services through their fire departments, and then also South St. Paul through Health East. But if you have anything to say, you're sure welcome to.
Senator Schoen, thank you so much, and to everyone who's joining us here tonight, and for all of you folks coming out. I'm just gonna say that the city of Cottage Grove is here as a partner to do whatever we can within the purview of what we do at this particular level. We appreciate and we're here to support, and I will kindly yield respectfully my time back to the floor for the experts here to have a little bit more time, so thank you.
Representative Jurgens?
First of all, I want to thank everyone for coming tonight. When Senator Schoen reached out to Representative Frankie and I to see if we would attend tonight, I really didn't know what to expect. Even coming in tonight, I wasn't sure what to expect. And to hear the stories that you brought to us, you know, it's eye-opening, and we have to hear those things. We have to keep that in mind as we're you know, discussing and debating different topics at the state level. This is real people that we're talking about, real people's lives, and we have to, you know, we never lose sight of that, but to put names and faces with those issues are very important. So I want to thank all of you for coming and sharing that with us. All of us up here and all of you are dependent on what happens in Washington. We have no more control over what happens in Washington than any of you do. But we're going to be left with whatever that is. We're going to be left with trying to fill in the gaps and fill in the holes from that. And it's going to take some doing, as has been mentioned several times here. And I don't think anybody here expects it to be easy. You know, this past session, most of the work that we did, healthcare related, had to do with the skyrocketing premiums in the individual market. And what we're hearing tonight, I mean, Medicaid is just another example and another facet of that. So I will, since Commissioner Bacon went a little long, I'll just end it right there.
Well, my name is Rick Hansen. I represent Northern Dakota County. I think this has been a very important presentation. I tend to break things down to almost the journalistic questions of what. You know, this is Medicaid. You talked about what is Medicaid and who's impacted. And I want to thank you for sharing your stories. And where is this happening? We look at if 23% of South St. Paul is on Medicaid, 17% of Hastings. These are our friends, our neighbors, throughout our communities. How are services provided? We get a little bit of that. The question that I think is the unanswered question is, why is this going on? Why is our federal government doing this? And then why is this going to be, why are we dealing with this? And it's a choice that's being made. Every budget is a choice. It's a choice on what you want to pay for and who you want to help and where that money goes and how it goes out. And so I think all of us are going to sit here wondering, why? Why is this happening? And we can wonder that, but something is going to happen, and it's going to be a radical experiment with people's lives. And then we are going to be having to deal with how to respond, and we will have to make the choices with the budget on what we spend money on, where we spend it, how, and who. And that's not a lot of choice that we want to be dealing with experimentation on. Representative Jurgens talked about the individual market. We spent a lot of time on that. And here comes this.
First off, I'd like to start by saying thank you, Senator Schoen, for inviting us, and thank everybody for coming. I think what you're going to get from a lot of us is we're kind of stuck at this point till the federal government decides what they're going to do. But one thing that's encouraging for me that I always like to look back on, and people have said it here tonight, the turnout that you have here in this area for the people that represent you. We all come together, we all work well together. As Carla said, she makes lots of phone calls. And we all communicate, and a lot of more than I think people realize, put the partisanship aside to do what's best for the people. And I think that's what we get in Minnesota, and that's what makes me proud to be able to come to things like this and get the information and have the discussions, because I think so much you hear these days on the TV and everywhere that people are afraid to go, or legislators are afraid or not showing up at forums or informational meetings or town halls. And I don't see that you're gonna get that in this area because we are all very open-minded, and I think we all have open hearts and open minds, and that we care and we are willing to put everything aside to work together. So that's what makes me proud to sit here today. And I'll pass it on.
Thank you. I will also want to thank those who are sharing their stories and the leadership to provide the information and the opportunity to have a forum and a discussion. And thank you, Dana. I also think about why things are happening. I also think about budgets are storytellers. If you look at a budget, it can just be a bunch of numbers, but it also reflects the values. Where is the money going? Where is it money coming from? And all of that tells a story. We need to be working together. I work a lot in prevention and early intervention. And you are really talking about interventions. And your stories, at least some of them, have shared with us the value of an early intervention. And the earlier, the better. Not only better for outcomes, but better for that financial story, because the costs are less. And so people show up in the ER, we know what that means. But if we spend a little bit of money for visiting nurses and some of the other programs that Minnesota has invested in, those are the prevention and early intervention stories that we see in our budgets, or we hope to see in our budgets. We need to work together. We need to be able to listen to each other. And I thank you for being here.
Thank you. My name is Matt Dean, and I chair the Health and Human Services Finance Committee in the Minnesota House. And thank you, Senator Schoen, for organizing this meeting tonight. I want to particularly thank the folks who came to listen, to share some stories about Medicaid Minnesota and how that works with all our other medical delivery services in the state, because they're all combined. They're the same providers, the same hospitals, and the same safety net that works kind of for everybody, works together. So it's very, very important that we kind of look at things together. 1 in 5 Minnesotans is currently on Medicaid. That's an important statistic. As we've grown Medicaid, the reimbursement for that has skewed the part that's growing. Our primary responsibilities for people with most need in Minnesota, people with disabilities. That is the primary need. However, we've got this incentive right now that says that if there's any reductions, the people with disabilities get hurt more. And that's just crazy. We shouldn't be doing that. So we need to look at this in a very fair way, and I'll give you 2 rays of hope from federal government. Number 1 is we've got the best health providers in the world right here in Minnesota, and we can do things the Minnesota way. We can either lead or follow what's going on in Washington, D.C. Ray of hope number 2 is that the states are going to be given a lot of flexibility in the coming year. And I think we either need permission or forgiveness to lead again in this state. And I think with cooperation we can do that. With partisanship we will ultimately fail. Thank you.
First I want to add my thanks to Senator Schoen for finding a place at the table for me here, coming all the way from Egan and Burnsville.
Yay!
I know them from the very beginning.
Thank you. This is the 3rd meeting that I've been to where I've been getting the answers to what is Medicaid, who is getting it, who is getting the advantages. And each time I hear some stories about what has happened to their families and how they would suffer if these 3 different bills that have been going through the U.S. House and Senate, if they had been voted on and approved. And it was really devastating to hear some of the stories that how it would affect Minnesota, how it would affect individuals. And the one thing that until yesterday that I would say is that it's in your hands. It's in my hands to know what is happening, but it's in your hands to communicate to the people that need to make the decisions. And I want to make sure that you know that, and that you know the power that you have. We have a constitution that says that we are guaranteed life, liberty, and pursuit of happiness. And life is one of the very important things, and it is mentioned first. So life is what you're after here, and a good life for all of the people that you're describing. So I really appreciate you welcoming me here in your community, and I'm hoping that when you walk out of this room, you know exactly what to do.
Well, thank you, and I want to thank all my colleagues for agreeing to join and listen to everybody's messages. I just want to say especially thank you to Kate. You know, that was an interesting, I got connected, was following her on Instagram, and reached out. She had had a particularly bad day and experience in the public, as many parents with autism do, where, you know, someone looks at you because your kid doesn't look like they should look like they have some sort of disability. They don't have a limp, they're not in a wheelchair. It's mental health, it's a connection there. And I reached out and I said, listen, I'm your senator, and if you need a place to get out in the public because you want to get out, you come to the Capitol and we'll bring 20 people to make sure that you can walk around and look at something in public. Because I understand what that is to try to bring your family member around and just have a normal life for 20 minutes. And I appreciate your time in particular, and Brian, and ma'am, your drive down, thank you so much for participating and taking that extra 30 minutes on a 45-minute drive. I thought we were talking about construction in Cottage Grove. Anyway, thank you so much, and I know that we did discuss, we have various parties represented in the room, whether it's Republican or Democrat. We all care. We may not all agree on the same road, but the destination is the right place. So Susie, thanks for facilitating, and I've got the microphone here for us. I'll bring it to you.
Oh, I don't know that we need it. We've gotten some good questions from the crowd that we've gone through, and so I think I can share those, and if that's okay with everybody. So thank you everyone for sharing your questions. We were able to combine a few of them into one, and we've got 3 here for some of our panelists. This one is first directed at Lynn, and then we'd like a legislator to follow up on that. We received a few questions about auditing the Medicaid program. How do we ensure that the HMOs who administer a portion of Medicaid are using the funding efficiently? And if Lynn would like to hump that to someone else, we also have the Chair of Health and Human Services here, Representative Matt Dean.
Yeah, I think I'll
One of the things that we want to make sure that we do is that if we are prioritizing people with high needs, disabled